So hello everyone. Now in this video we'll be talking about lactation. For the first 2 days following the delivery, no further anatomic changes in the breast occur. The secretion from the breast is called colostrum, and which starts during pregnancy becomes more abundant during this period, this puerperium. And the composition of the colostrum is that it is the deep yellow serous fluid, alkaline in nature, and it has got higher specific gravity, higher protein, vitamin A, sodium and chloride content, but has got lower carbohydrate, fat and potassium than breast milk. Colostrum has 8.6 gram of protein, whereas breast milk has 1.2. Similarly, the fat, carbohydrate, uh, and content is more in colostrum than in breast milk. Sorry, less in colostrum than in breast milk. The colostrum and milk contain immunologic components such as immunoglobulin A, complement antibodies, macrophages, and lymphocyte, antibacterial product, lactoferrin, and other enzyme like lactoperoxidase. Macroscopically, it contains flat globule and colostrum corpuscle and acinar epithelial cell. The colostrum corpuscle are larger polynuclear leukocyte, oval or round in shape, containing numerous flat globules. The advantages are the antibodies IgA, IgG, IgM, and humoral factor lactoferrin provide immunological defense to the newborn. The breast milk has laxative action on the baby because of large fat globulin, and it reduces the allergy and allergic diseases. Talking about physiology of lactation, although lactation start following delivery, the preparation for effective lactation start during pregnancy, and the physiological basis of lactation is divided into four different phases. One is mammogenesis, that is known as preparation for breast. Second one is the lactogenesis, the synthesis and secretion from the breast alveoli. Third one is galactokinesis, that is the ejection of milk. And finally, galactopoiesis, the maintenance of lactation. The endocrine control in relation to different phases is shown in the given picture. I will be showing. So this picture shows the endocrine gland in relation to lactation. Different phases has different endocrine control. Talking about all this in short, the mammogenesis, the pregnancy is associated with remarkably growth of both ductal and lobulo-alveolar system, and intact nerve supply is not essential for the growth of mammary gland during the pregnancy. And talking about lactogenesis, that is synthesis and secretion of from the breast alveoli. Uh, the alveolar cell are the principal site for production of milk. Though some secretory activities is evident, that is a colostrum during pregnancy, they accelerated following after delivery. The milk secretion actually starts off on third or postpartum day. Around this time, breast become engorged, tense, and tender, and feel warm. In spite of high prolactin level during pregnancy, breast secretion is kept in is halted, and probably the estrogen and progesterone circulating during the pregnancy make the breast tissue unresponsive to prolactin. When the estrogen and progesterone are withdrawn following delivery, the prolactin begins its milk secretory activity in the previously fully developed mammary gland, and the prolactin, insulin, growth hormones, and glucocorticoid are the important hormones in this stage. The secretory activity is also enhanced directly or indirectly by growth hormone, thyroxine, and insulin. For milk secretion to occur, nursing effort is not essential. Next one is galactokinesis, that is ejection of milk. The oxytocin is a major galactokinetic hormone. The discharge of milk from the mammary gland depends not only on suction exerted by the baby during suckling, but also on the contractile mechanism which expresses the milk from the alveoli into the duct. The third phase is known as a galactokinesis. These phases can be remembered by MLGP, the mnemonic MLGP: mammogenesis, lactogenesis, galactogenesis. Third is galactokinesis. Oxytocin is the major galactokinetic hormone. The discharge of milk from the mammary gland depends not only on the suction exerted by the baby during suckling, but also on contractile mechanism which expresses the milk from the alveoli into duct. And next one we have the And the prolactin and oxytocin, these both affect the function of the breast target cell. Prolactin stimulates alveolar epithelium to secrete milk, and oxytocin stimulate myoepithelial cell that surround the alveolar epithelium to contract and to eject the milk from the acini to the duct. And during suckling, a conditioned reflex is set off. The ascending tactile impulse from the nipple and areola, the nipple and areola pass via thoracic sensory 4, 5, and 6 afferent neural tract into the periventricular, into the paraventricular and supraoptic nuclei of the thalamus to synthesize and transport oxytocin into the posterior pituitary. And the oxytocin efferent arc via broad is liberated from posterior pituitary, produce contraction of myoepithelial cell of the alveoli and the duct containing the milk, and this is called as milk ejection or milk letdown reflex, whereby the milk is forced down into the ampulla of lactiferous duct, where from it can be expressed by the mother or sucked out of by the baby. The presence of infant or infant's cry can induce letdown without suckling, and the sensation of rise of pressure in the breast by the milk experienced by the mother at the beginning of suckling is called as drought, DRAUGST, drought, and this can also be produced by injection of oxytocin. And the milk ejection reflex is inhibited by the factors such as pain, anxiety, breast engorgement, and adverse psychic condition like depression, and the ejection reflex may be deficient for several days following initiation of milk secretion and result in breast engorgement. Now the fourth phase we have is the galactopoiesis. The prolactin appears to be single most important galactopoietic hormone for maintenance of effective and continuous lactation. Frequency of suckling is more than 8 out of 24 hours is essential. The distension of the alveoli by retained milk is due to failure of suckling, and this causes decrease in milk secretion by alveolar epithelium. The ductal and alveolar distension due to failure of milk transfer suckling is cause of lactation failure. The milk pressure reduces the rate of production, and hence periodic breastfeeding is very necessary. And talking about milk production, the healthy mother will produce about 500 to 800 ml of milk a day to feed her infant. This requires about 750 kilocalorie per day for the mother, which must be made from diet or from her body store. For this purpose, a store of about 5 kg of fat during pregnancy is essential to make up any nutritional deficit during lactation. And stimulation of lactation, mother is motivated as regard to benefit of breastfeeding since the early pregnancy. No pre-lacteal feed, honey or water are given to the infant. Following delivery, important steps are to put baby for the breast for less than 1 hour, plenty of fluid to drink, and to avoid breast engorgement early, and exclusive breastfeeding is in correct position is encouraged. Stimulation of lactation, mother is motivated as we already said, and the inadequate milk production, the lactation failure. It may be due to infrequent suckling or due to the endogenous suppression of prolactin by the drugs like ergot preparation, pyridoxine, diuretic, or retained placental bit. The pain, anxiety, and insecurity may be the hidden reason, and the unrestricted feeding at short interval for 2 to 3 hours is helpful. And the drugs which improve the milk production are are known as galactogogues, and these are the metoclopramide 10 mg thrice daily increases the milk volume by 60 to 100% by increasing prolactin level. The metoclopramide and the sulpiride dopamine antagonist like amisulpiride, these are also helpful, and domperidone has been also found to be effective by increasing prolactin level. And intranasal oxytocin contracts myoepithelial cell and causes milk letdown. And that's why this is called as this is for increasing the milk production. And sometimes the lactation might be suppressed. It may be needed for women who cannot breastfeed for personal or medical reason, and the breast milk has to be suppressed. and is suppose do as if the lactation is suppressed when the baby is born dead or dies in the neonatal period, or if the breastfeeding is contraindicated. Method commonly used are to stop breastfeeding, to avoid pumping or milk expression, to wear breast support, to ice packer to prevent engorgement, and analgesic like aspirin to relieve pain, and a tight compression bandage is applied for 2-3 days. And natural inhibition of prolactin secretion will result in breast involution. And the medical method of suppression with estrogen or androgen is not advised. The bromocriptine inhibits prolactin secretion, and it is given orally for 2-3 days. And contraindication are hypertension in puerperium, seizure, cardiac valvopathy, the bromocriptine. And breast milk for a premature infant is beneficial by many ways, by psychological, nutrition, and immunological. Metabolic disturbances like azotemia, hyperaminoacidemia, and metabolic acidosis are less with breast milk compared with formula. It gives immunological protection to the premature infant, and there are method for collection, that is manual expression or electric pump, and milk formula, milk preservation. And in next video we'll be talking about management of normal puerperium.